This is a quick guide to understanding the Federal Employee Health Benefits Program. We're going to cover eligibility to enroll in health benefits and when you can make changes. We're going to go over how to complete the enrollment form, also where to find the information that you need to complete that form, as well as cost and plan information that will help you in making choices about programs for you. We're also going to touch briefly on the implications of part-time work schedules for career and term employees, what happens when you go into non-pay status or leave without pay, and touch on your options at separation. Eligibility. Temporary employees, that's generally going to refer to our 1039 seasonals, who are working less than a year but who are expected to work for at least 90 days and at least 130 hours per month, so that would be 30 hours per week. They're eligible to enroll in the health benefits program. The government will pay the full government contribution in those circumstances. Permanent and term employees are eligible to enroll in a health benefits program. They will pay a prorated amount if they're working less than full-time. We'll address that later. Your initial eligibility is 60 days from your first employment. You also have opportunities to make change or to enroll after that with certain qualifying events. Making changes. So normally there's an open season from mid-November to mid-December each year, with the changes being effective the first full pay period in January. You can find on the Office of Personnel Management website qualifying life events and open season information. That's going to explain to you the different opportunities you have when something like a marriage, divorce, birth of a child aging out of eligibility occur. Or there are things like if you have changes in work schedule, changes in geographic location, going into OWCP, something like that. So there are a lot of circumstances. We're not going to address each one here, but do know that there are opportunities to make changes or to enroll after your initial enrollment. Another place to find information about qualifying events is on the SF 2809 enrollment form itself. You'll find a table listing event codes. These are the codes that you'll need to fill out the 2809. We'll get to that again in a few minutes. But this tells you the opportunities you have to make changes, and each of these events, you can read through these. There's about 3 or 4 pages of tables. They explain to you the changes you can make with various circumstances, such as a change in family status, an increase or decrease in the number of family members would allow you to make these specific changes within these specific time frames. So this is a good source of information for you to read and find out if you qualify to make a change after your initial enrollment period. Few common questions. You have 60 days from the beginning of eligibility, if that's your first day of employment, not the first time you receive a communication from us, to make your enrollment. You must be in pay status for the pay period prior to your enrollment beginning. This does not mean you have to be in pay status for the entire pay period. For example, if you started working on February 10th, that's not the beginning of the pay period, you would be eligible for your first enrollment on February 22nd. That's the first day of the following pay period. Also, your enrollment will start the first full pay period after we receive your enrollment form. So for example, if you started working on February 1st, that's midway through a pay period, you'd be eligible to enroll as early as February 8th. However, if you don't send to us your enrollment form until February 20th, we won't enroll you prior to February 22nd. Your agency does not mail insurance cards to you. Those will come directly from the carrier that you choose once your enrollment has been processed. A copy of your SF 2809, the enrollment form, will be available to you in your EOPF. You'll need to get access to that. We cover that in another video. But if you need to provide that form to a carrier, former carrier, to prove that you've enrolled, you can get a copy of that there. Also, be aware that FEHB, that's the dental and vision program, is separate. While your FEHB program may have a dental and vision component, if you want to sign up for the FEHB dental and vision programs, you do that through the Benefeds website. There is some interaction between the programs, but you do need to explore that separately. Temporary employees working less than a year on their initial appointment are not eligible for FEHB. You can also check your enrollment information on your leave and earnings statement. If you're unclear as to whether or not your enrollment has been processed by a certain pay period, check out your leave and earnings statement and look for the health benefits deduction. This 3-digit code here, that will indicate the plan in which you have been enrolled. So that would be the plan that you chose on your SF 2809 and how much you're paying for the pay period. Some people are confusing the Medicare tax with a health benefits deduction. Medicare, medical, sounds like healthcare. But that does not indicate that you are enrolled in federal employee health benefits. That indicates you are paying Medicare tax, which is not optional, and all employees pay that. You can also look down here at benefits paid by the government, and where you see FEHB, that tells you how much the government is paying on your behalf towards your healthcare premium. You can also look for that SF 2809, as we said before, in your EOPF. So when you log into your EOPF, you will look down here on form numbers for SF 2809. Health registration form, that'll tell you when the effective date is. You can also view your election form and download and print it if you need to provide it to another medical provider. If you make your change through Employee Express, you'll see DG62. That's another FEHB form based on the fact that you made the change in a automated system. 2810 will be placed in your EOPF if you do something like make a change in name, or if you are terminated. You'll also be able to access those in your EOPF. Completing the mysterious SF 2809 enrollment form. The form is about 15 pages long. There are several pages of instructions. They're helpful. It'll also tell you what your future opportunities are. You only need to return the last 2 pages of the enrollment form to us. When you complete the form, please complete all these highlighted sections here. If something is incorrect or missing, we can help you correct it, but you do need to provide this, particularly a phone number. This is required when we enter this into the personnel system. It won't accept it if we don't have a number. We can all save time by making the form as complete as possible initially. If you're signing up for a family plan or Self Plus One plan, you can enter the family information here, and you would enter the relationship code on this line here. The relationship codes come from a table on the SF 2809. These codes here are what go in this section here. Sometimes this can be confusing for insurance companies, and they may question eligible family member's relationship to you. It's a good idea to have this accurate the first time around. Continuing to page 2 of the enrollment form, this section right here is where you provide us that 3-digit enrollment code. This comes from the last page of the brochure. We'll go over where to find those in a few minutes. We can help you determine the event code if you need and the date of the event. You must sign this form. We can't sign it for you. We can help you with just about everything else, but you have to sign that. Once we receive it, your Human Resources office will complete this lower section here and enter it into the personnel system. You can make changes in Employee Express. You cannot make your initial enrollment through Employee Express. You can make open season and qualifying life event changes through Employee Express. You'll need the same information that you would put on the SF 2809, so you will need to do your plan shopping and research first and have your enrollment codes available. You'll be self-certifying for a qualifying event. There are some pretty significant warnings about penalties and fines that are associated with fibbing about this, so don't do that. Plan shopping, finding the information, choosing a plan. Most of the information is going to be available to you on the OPM website, so go to www.opm.gov. Click on the Insurance tab here at the top. You'll find a drop down, choose Healthcare, and that'll take you to the plan information. You can click on that. It's going to take you to a map of the United States. This is sort of the home page for all things. You can find information about comparing plans, premiums. We'll return to this section later, but this is sort of where you're going to navigate to the various options you have. So for this example, let's choose California. Click on the CA. That's going to take you to the plans available in California. There are 3 different types of plans. The nationwide fee-for-service plans, you're going to see that at the top of that group. These plans are available to anyone all across the country, and the premiums do not vary. They're also going to be the most portable. They'll move with you if you change park locations. The state-specific or geographic-specific HMOs are going to be in a separate section of this page down at the bottom. You'll want to make sure you're eligible for that. We'll go over that in a few minutes. The plans that are open only to specific groups, you're not one of these groups. If you're looking under this section here and you try to enroll in one, it's not going to work. The geographic specific plans, you'll see the state specific HMO or high deductible health plans there as well. When you're looking at these plans, you must be sure that you are in an area serviced by these plans. If your mailing address that we enter into FPPS along with your enrollment, if the zip code does not match their coverage area, it will not accept your enrollment or it'll kick you out. So let's look example. There's a California North plan and a California South plan for this Kaiser program. If you enroll in the wrong plan, you're going to be considered out of their network, and there's a lot of problems and corrections associated with that. You don't want to make this mistake. So we open a plan brochure. Anytime you click on the plan brochure, this is going to be a 100 to 150 page document that explains to you everything that the plan covers, your options. Generally, it'll cover different, the family, self, or self plus one option, how much each one costs. But this is a crucial document for you to understand the coverage area if you're choosing an HMO or the coverage for specific conditions. You are responsible for reading and understanding this plan. So within the plan brochure, if you're looking to enroll in an HMO limited to specific geographic areas, the geographic areas will be indicated in the brochure. So this is again going to be the Southern California plan. We are going to check to see if we are in their required area. You can check page 13, but again, you must live or work in the geographic area to enroll, and the address that you provide on your enrollment form is going to be the determining factor for that. So checking the service area, again, you must live or work in the service area in order to be covered there, and it'll tell you the full counties that are covered. Again, this is an example of a Southern California plan, so these full counties are covered. There are also partial counties, and the language may be such that you're looking for zip codes that are excluded, not included in the plan. So read this very carefully to determine whether or not you're eligible to enroll in that particular program. The final page of the brochures are going to provide you with the enrollment code. So it'll tell you the type of enrollment, and this goes in box C on that SF2809 form. The 3-digit enrollment code, and this is most important because this is what we enter into the personnel system for the plan you chose. This is where you find the information, and this is where you enter it on the SF2809. This will also tell you the cost. You are looking at the non-postal bi-weekly employee portion to determine how much it's going to cost you. Remember to look at the bi-weekly schedule because that is how you are paying in. It's going to be deducted from your paycheck. It also provides you the monthly information if you'd like to compare it to plans that pay on a monthly basis. We don't use that information here. The part-time implications, if you are a career or term employee, this does not apply to 1039s who are eligible and then move into part-time status. Career employees in a part-time status pay a prorated amount. So again, if you go to the reference manuals on the OPM webpage, it's going to explain to you how the government share and your share vary with the part-time work schedule. Government contribution is proportionate to the number of hours you pay work between 16 and 32 hours per week. And if you go to the bottom of the page, you'll find some examples. We're not going to go through one right here on how the number of hours that you work during a pay period affect the government's contribution, and then how much you have to pay as the government contribution is reduced. You can see at the bottom of that page, you'll find a table telling the number of hours you're working per pay period and the factor by which your contribution will change. Comparing plans. Again, we're going to go to the OPM homepage. The first place you can look is under premiums. You are a non-postal employee. There are two separate tables, one for the HMOs and one for the nationwide fee-for-service plans. Also, this year, which hasn't been available in the past. The TCC, that's for once you've separated from employment. The rates that you'll pay for that are also available as a separate table. The table, once you open it, will provide a summary of costs. These are the costs for the biweekly rates. It tells you how much the employee pays and also how much the government is paying. Be aware that with the new Self Plus One options, some plans the Self Plus One option is more expensive than the family option. Don't just assume that Self Plus One is less expensive. You need to look at the amount that the employee pays in order to determine whether you can afford this plan, and then look at the brochure to see what it covers, to see if this is the right option for you. Your HR office can point you in the direction of this information. They cannot make a choice of plan for you. The temporary continuation of coverage table, also available from that premium page, tells you how much it costs on a monthly basis if you are going to enroll in temporary continuation of coverage after you separate from employment. Keep in mind that this is a monthly rate. This is generally going to be equivalent to your premium while you're employed plus what the government was paying plus 2%. It's not necessarily a cheap program, but this is what it's available to you. This also gives you information for former spouses based on whether or not there's a spouse equity agreement in the separation or termination of the marriage. A former spouse who is covered under a family plan is eligible to enroll in temporary continuation of coverage. There are a few separate rules we'll cover on a little bit later. Again, shopping for tools, there's also a plan comparison tool on our OPM healthcare page. You're going to choose compare plans. Then you're going to run through the information. You can choose nationwide plans or others. Put in a zip code or plan information. We're going to go by zip code here. Search for some Colorado plans. Click search. This is going to be non-postal again. You pay on a bi-weekly basis. This is going to bring up the plans within that zip code. They're available to you. You can choose up to 4 at a time. And then click on Compare Selected Plans. This is going to bring up a table. The plans that you chose will be indicated. And then it's going to tell you what it pays in certain circumstances, what the limits are. You can also make further comparisons. Do further comparisons. You can choose multiple plans, and you can choose different things that plan is going to cover. This is going to bring up another side-by-side comparison of the plans, and it'll tell you what they're going to pay for specific options. You can also bring up the brochure for each one of these plans if you have specific concerns such as chronic conditions or prescription medications, what that plan is going to cover. It's your responsibility to know what the plan covers. Again, there can be quite a lot of variation. For example, emergency room. Some plans will pay different amounts within and without of the networks. Some cover everything, some cover nothing. There is quite a bit of variation. It's up to you to do the shopping for this. Let's touch on a few leave without pay or non-pay. This would be the subject to furlough considerations for career seasonal employees, also for people that go into intermittent status. You have 3 options: to accrue a debt, to pay the premiums directly, you won't be billed, or to terminate and come back on. We're not going to go into too much depth here. When you are going into one of these statuses, an election form will be mailed to you, and this is where you can make that choice and return it to your HR office, and they will help you make those changes when you're going into leave without pay, furlough, or intermittent status. Finally, when you terminate or resign from your position with the government, you have the option to enroll in temporary continuation of coverage. To find information specifically about this, go back to the OPM webpage, click on temporary continuation of coverage. The pamphlet section is the most helpful. It will give you an overview of what TCC is. It's basically the government equivalent of a COBRA plan. It'll explain the costs and the time frames. We have another video that explains your options here. Feel free to call your HR representative before or after you terminate. We'll send this information to you when you terminate, but it never hurts to be able to plan ahead and make those decisions. The agency does not coach you through your options with the Affordable Care Act, but do feel free to call about any of the topics we've discussed in this video to get further explanations.